to another episode of Lip Service where we talk all things lipedema. Yes, it is confirmed. I do look like a drowned rat. My hair is soaking wet. I'm about to head to work, but I figured I can't wait another day and I need to catch you guys up on the Boston Lymphatic Symposium that I went to last Friday. It was at Harvard Medical School, and for clinicians, it was a 2-day symposium, and for patients, it was 1 day. And I went on Friday, and it was very, very educational, and I just wanted to fill you in on it. So without further ado, let's get going. So there was a lot of different physicians, clinicians, whatever you want to call them here at the symposium. So there was biochemists, physiotherapists, surgeons, endocrinologists, like you name it, they were there. And they talked about a variety of different topics such as pain, weight management, GLP-1s, surgery, patient perspective. I mean, there was a lot of different topics, so it was really intriguing to hear more about it, learn, get to meet some people, and I've even met some people even on TikTok afterwards. I was like, hey guys, I actually sat next to you, and they're like, wait, you should have talked to me, but I was being shy that day, so I didn't really talk to too many people, but overall, it was a great experience. So thank you guys for hosting it. I guess the Boston Lymphatic Symposium has been taking place for 7 years now, and this is the first time they've actually focused on lipedema. So it's huge. People came from all over the world, and I will tell you most of the people that spoke during the symposium were from Europe, mainly Germany. The endocrinologist was from Texas, but it was really interesting to see the advancements that other countries have where the US is so far behind, not only on testing, but just acknowledgement and treatment of lipedema. So yeah, really interesting for sure. And I got to see my occupational therapist because they brought the clinicians and the patients together for the keynote speaker. So I got to sit with her and kiki a little bit. But we have so much to talk about. So the understanding pain component, they actually did some scientific studies and showed different charts and all of that. And I did post a quick little reel on Instagram and TikTok. But I can certainly send you guys the slides that I took pictures of so you can get a good understanding. But they broke it up, especially in the legs. They called it decades because they broke it up into 10 different segments, but then they've also tested the arms. There was all these different slides of areas that they have tested to recognize pain levels. And they also did a controlled study with the hands too, because lipedema doesn't affect the hands. So they wanted to just kind of gauge the level, the pain threshold within hands versus legs. So it was really quite interesting on that topic. And then, so yes, okay, so here I did take notes, guys. It was a quantitative study, and it was hands versus thighs, and there was a drastic difference, in their mean sensory profile that they had called it. And having the controlled area is actually good for scientists. So when they know that the hands aren't affected, it's not like a placebo, but they can definitely mark the pain levels in the hands versus now going through the thighs and being, painful to the touch and all that stuff. It's easier to gauge, I suppose. So right now there's actually no professional specific lipedema pain treatment. It is not available. They do not recommend using opioids for long-term use. So treatment levels look different for everybody. That could be compression garments, MLD, GLP-1s, vibration plates, you name it. There's different treatments, and some work for others, some do not work for others. They talked a lot about diets, especially the keto diet and the Mediterranean diet. And then I'm also, okay, so hold on, let me backtrack because this also goes into the dieting component. I've had stomach issues my entire existence, I feel since I was 8 years old. I started to experience really bad stomach issues, and I'm 41 and still have them. But at 18 years old, I had my gallbladder taken out, and I'm still sick. I just now have to take daily medication to make sure I don't shit myself, so that's always fun. And they were talking a lot about hypermobility. And I was just wondering, am I kind of on the borderline of hypermobility? Because I'm chronically locking my knees, but I don't feel like my other joints necessarily are doing, they were talking about your elbow going out. Well, you can't see because I got my lunch lady arms, but pointing outward, if I were to slim down a little bit to be able to see, or your thumb going, there's certain things, that I'm like, I don't really feel like I have hypermobility, but it's snowing again, guys. I live in Boston. I'm so over it. And I'm like on limited time because I do need to get to work before. And now the storm. We just had a blizzard literally 2 days ago, and it's now snowing again. I'm about to cry. My window's right here, but you guys can't see. Anyway, so talking about hypermobility, and with that actually comes digestive issues. So I was like, oh my God, I literally have so many more diseases than I thought I did. But hypermobility definitely ties into lipedema, and that was my very long story. Very long-winded, but here I am. I can never tell you a short story. I'm like, so short story long. Here we go. All the details. So they were talking a lot about keto dieting, and I don't know if I would be able to handle that because they did say, some of the side effects. It's like diarrhea, constipation, ready to pass out, ready to do this, and being perimenopausal, and I feel like my blood sugar drops and all that stuff. I just don't know if I'd be able to tolerate that. Even at the symposium, I ate fruit for breakfast, and then I had a buffalo cauliflower wrap with avocado and tomato, and let me just tell you, that destroyed my stomach. And like, people think I'm like so outrageous when I tell them I actually feel better like eating shittier foods than I do healthier foods. And I try to eat healthy foods, my body literally just does not react well to them. So that could be a completely like different thing aside from anything else that I have. Maybe it is my gallbladder, maybe it's not, I don't know. But I'm like, I do also have like a wheat allergy, but I was like, give me bread all day long and I would feel so much better than if I were to eat that sandwich again. So fun fact, I'm just like a medical mystery. I hate it. They also had tested for like different types of therapies, and I don't remember if I took a picture of the slide or not, and I think I did not, which is why I didn't write it in my notes. But there was like cold therapy, hot therapy, pressure therapy. They were doing all these different things to try to get the scientific study component. They were even talking about cryo freezing towards the end of it with the physiotherapists. As I have mentioned before, just in conversation, and I don't know if I've talked about it on my podcast. Is this a podcast? I don't know. But blood tests are not picking up any abnormalities. And this is what gets me so frustrated, because I always get a CBC and I'm like, okay, what is happening? Every level is normal. I'm not understanding like why it's not picking up that I have like any issues. So other people are experiencing this. And it also made me mad because I did get a CBC a few months ago, and I was like, no, my estrogen is like totally off, and I know it is, and it showed as normal. I'm like, I know my body, and like there's something going on with it. So I got to do further testing. Okay, and they also did a test called the SALT test, and it was sodium, adipose, lymphatic, and transitional, I believe was the other word. And of course, I was like so enthralled. I was looking at the slides and then writing later, and then of course the slide went off. But they were testing like the sodium within tissue and subcutaneous adipose tissue, and it's higher in areas with lipedema and lymphatic insufficiency. So I thought that was really interesting. And the physician that was speaking said that she will double check on the correlation to blood pressure, because they were talking about blood pressure versus like with lipedema, and if there was like any different type of like connection or relevancy to that. Okay, I've had this frog in my throat literally since December, and I'm over it. We're almost in March, guys. I'm like so frustrated. All right, let me see what else there is. So the GLP-1, it was interesting. The endocrinologist from Texas was going in and talking about like different patients that he's had, and gave literally a timeline of a handful of patients of his of, they tried this particular GLP-1, but then insurance stopped covering it. And then so we tried this one, and then we ended up using two. And he was documenting their weight at every check-in. And some of them were yo-yoing, and then some of them consistently went down. And during the question asking portion of his speech, there were some patients there that had mentioned that GLP-1s have been working amazingly well for them. One of them was actually saying that she is now developing an eating disorder because of it. And she is purging everything that she's intaking, and she knows that she has to eat, but she's not really hungry. And then she went to Mass General, and they really can't find like what's wrong with her. And I know that that's super frustrating. Then I had a woman behind me that was saying that she's been on GLP-1 for 8 months and literally has not lost 1 ounce of pain. And this is like where my huge debate is, because about like 2 weeks post surgery, I will be talking to the nutritionist who, well, it's actually an endocrinologist too, and also talking about GLP-1. And I've really been hesitant on going on there, not only because of my stomach issues, but because of all the other side effects. And I feel like my body is so sensitive, and I don't know if I want to subject myself to that. But people have been talking about the inflammation really going down, and I think that would be like the major benefit. So we'll see what happens. I'll keep you guys posted. I'm like really kind of torn. I was kind of leaning towards it more on Friday because of the positive reviews, but then I do also, again, know my body, and I'm not sure if I want to go in that route. I don't know. TBD. If I become like a skeleton, like GLP-1 advocate, please shoot me, because I don't actually want to be like those people. And like, yeah, I definitely hold like weight in my face. I mean, I was looking at a picture on Facebook Memories this morning. I literally had like a jawline. Now it's like just really soft double chin. But I don't want to have the Ozempic face. I'm just telling you guys right there. So if I'm like, no, cut the camera. I'm not doing that shit, okay? Obviously, they were talking about physiotherapy, like just physical movement is so important, even if you're in pain. I mean, obviously not if you're in pain, like, you know, push yourself too hard, but low impact exercising, walking, swimming, anything to kind of like also relieve the joints. And they did say that like swimming, because the water in your body versus like the water that you're in, swimming in, there's like some kind of composition where it's actually more like beneficial that way. But low impact workouts for sure. And I did kind of think it was interesting on the nutritional management side of it, because they talked, again, very heavily on the Mediterranean diet and keto diets, and they did studies about them, and they were talking, they had people with that were obese with lipedema, and then just women that were obese, like no lipedema. And they were just trying to test the diets to see, you know, what like the weight loss is. And they had like controlled studies and all this stuff with that. And it's just really interesting to me, because everybody is focusing so heavily on the dieting component, but then literally like everybody that presented basically said that lipedema is diet and exercise resistant. So I just am kind of like confused, and you know, people chime in if you are watching this and you know more about it. Obviously, I think the dieting component would help with the obesity. If you do have, you know, if you are obese and you do have issues with that, I definitely think it would help curb, and yes, help curb the inflammation, but it's not getting rid of the lipedema fat. So I think dieting and exercising are certainly important for anybody, you know, not just people with lipedema. I think for a lot of medical conditions or just overall health. But why are we putting such a heavy focus on the diets if we know it's resistant? So that's kind of like my only thing that's lingering. So TBD on that. But yeah, I'll fill you guys in. I finally had my doctor's appointment. I was such an asshole. I told you that this next episode was going to be talking with my doctor, and guess who missed their virtual appointment? Yeah, it was me. I was so mad. It was for 3:30, and I didn't realize till after 5 o'clock I missed it because I was so busy at work, and I paid a $50 copay just for that to go down the drain. But I met with my doctor yesterday. I had a handful of questions for him that I am needing to prepare pre and post surgery, and just trying to figure out what the best course of action is for my recovery, and especially preparation. And I'm feeling pretty good. I'm definitely still nervous. I don't want to be on like an episode of Botched, you know, where I end up like having a peg leg because whoops, we amputated one. But I am getting more excited as the days go on, because I do feel like there's hope. I'm in a lot of pain lately, and I don't like actually think I'm in pain until I'm realizing like, oh shit, this actually hurts. And it's increasing like as the days go on. So looking forward to that. But I will definitely fill you guys in on all of my doctor stuff, my preparation. So stay tuned for more episodes of Lipedema Lip Service. All right, I'll talk to you guys later. Have a great day, and please pray that my Boston doesn't get any more snow. I'm over it. All right, thanks guys. Bye.